as soon as possible. Alternatively, you can type on Google IGNOU admissions and you will be redirected to the Samarth portal of IGNOU and go and register there and take admissions as soon as possible. In case of any query, you can write to us at satyaraj@ignou.ac.in. Happy learning!
Dear learners, today we will be discussing a topic from Community Health Nursing Practical, that is BNSL 209, Unit 4 from Practical Manual 2. As it has been earlier informed that this Practical Manual 2 has got all the adopted units from Certificate in Community Health Program, and they have been integrated in post-basic BSc nursing program of IGNOU, and it has been implemented since year 2023 batch, which is first year batch of 2023. So that you will be provided with the logbook in first year only, and this logbook will be utilized by you for all 3 years. In that, the unit, which is unit 4 for the practical of community health nursing, which is involved with the swelling, lumps, examination, as well as the screening and management of the joints and lumps and swelling. So in this unit we will be discussing about the how you are going to prepare the patient for any examination, for the general examination, as well as what are the various methods by which the examination of the lumps and the swelling will be identified by you. It can be identified during the general checkup, as well as you can organize some camps for various age groups, and during that you can do the screening for early identification of the lumps or the swelling which is there. And this has been also part of the national program for the prevention and control of non-communicable diseases, under which various activities are carried out for the early identification of the symptoms, and patients are really benefited with the early identification, and they can be managed promptly as per the national health program. So this practical involves various techniques of examination of the lumps. So the objectives of this unit are to systematically examine the common lumps and swellings, so that you recognize and early identify the conditions like lipoma or hernias, sebaceous cyst, thyroid lump nodes, breast lumps, and the joint swellings. So first of all, you need to do the preparation of the patient for the physical examination. As all of you are in service nurses as well as our GNM nurses, so you are always in the clinical area where you are doing the examination. So for doing any procedure, you ask the patient to you explain the procedure to the patient. So these are some of the general instructions which you all know, that whenever you do any procedure you need to inform or explain what all you will be doing with the patient and why you are doing it. So what is your objective? So in case of particularly for the lump examination, you need to indicate the position of the lump or any previous lumps. Also you consider that whether there was lumps previously or not. You explain the procedure and you only expose the adequate part, which part you are going to examine as per the need of the patient or as per the complaint given by the patient. So you ensure patient's dignity. You examine a female patient, which should be done in the presence of a female attendant, or it can be relative of the patient, or there can be one more nurse who is, if the patient is alone. And ask the patient if there is any tenderness also and recent changes in the breast, in the lump, because it is very important to know the size of the lump, and patient is coming to you a first time. So maybe patient has observed that lump or felt that lump many days before, and today she is coming, so you can ask whether it is increasing in size or any changes in the lump size. So then you are also taking their lump history. You are doing general examination, which is done using various methods. As you know that you do inspection, you do palpation, auscultation, percussion. So these are the basic methods for any examination. So the same are followed for the examination of the lump also. So you look various findings by observing, then you feel with the help of fingers, you do palpation, and then you are, even there are specific tests which can be done later once you have ensured that yes, there is a lump. So when you are taking the history of the lump, so in that you can ask when the lump was first noticed, and what made the patient notice the lump, and why patient noticed that it is a lump, or he is feeling something, some pressure or some increase in the size of the breast or any organ where the patient is. Even it can be asked to the patient, has the lump changed in size or the texture since it was first noticed, or whether it is progressing or not. So because patient is having that lump from the maybe from longer period, but patient is coming to you for the first time, so you will need to ensure by asking these questions. So has the patient ever had any other lump also? So you can ensure that it is only single lump or there are many lumps in the as per the complaint by the patient. So what does the patient think caused the lump? So you can ask about the whether anybody in the family also had history of a lump or not, or it is the first person in the family having this problem. Is there loss of body weight? Because these are some of the clinical indications which need to be asked, or because they can help in the diagnosis. And is there any recurrence after the operation, whether it or the patient had some history of previous surgery, or whether it has appeared now, because it will ensure, this history will ensure that is there incisional hernia or not, because it happens after the operation also. So when you do general examination, you will just observe the patient, general well-being of the patient. You are observing whether patient is having proper gait or walking steadily. You can take the vital signs of the patient, temperature, pulse. You can assess for the pallor, whether a patient is anemic or the all the limbs are in order. Eyelids you can examine, or if there is any enlarged lymph nodes that you can see. And you look, or when we say the observation method, so what all you will observe in the lump, you first of all, because you are now focusing on the lump history, so you need to know the location of the lump or the position of the lump, where the lump is. It can be in the neck region, it can be in the breast, it can be in the abdominal cavity or in the groins. So depending upon what is the complaint of the patient, you will need to write the location contour, whether it is regular or irregular, which you observe. Then pulsation, like check for the any aneurysm or the high blood flow, or you will see that it is there is some blood vessel which is protruding and it is pulsating, so it can be observed. Then number of lumps, whether it is single lump or there are many lumps, that you can ask and look or ask the patient also. Then shape of the lump, whether it is spherical by observation and whether it is hemispheric or pear shaped or it is kidney shaped. So depending upon your observation you can mention, and the size of the lump you can measure and write if you are able to locate it. Then you also note the color and the texture of the overlying skin on the where there is a lump over that skin, whether you check for the smoothness or the whether it is shiny or whether it is thick or rough skin. So these are the findings you can observe over the lump. Then any scars or any ulcers or any discharging sinuses, whether it is having some discharge also when you so you can observe and write your findings. Then check for the abnormal blood vessels and impulse or on cough. When the patient is coughing, that time you will see whether the size of the lump, you can observe that during that moment of coughing over the lump. Then feel the lump, or when we say feel the lump, this is the second method of examining, that is the palpation. So in this palpation you are feeling with the help of your fingers. So when you feel the patient, because by observing you cannot check whether it is hot or cold, but when you feel it, that time you can check the temperature by touching and compare it with the nearby or the adjacent. Normal skin also you can check, other than the lump swelling. On the lump swelling, how you feel, whether it is hot or cold, and the same area on other side where there is no lump, there also you feel and check whether it is hot or cold. So by palpation method you can check the temperature over the lump. Then the tenderness is another finding through palpation, because in which if you are touching that site of the lump, whether it is painful or not. So you can say yes or no. So feeling pain on touch. So patient will say, I am feeling pain. So you can write down, yes, there is tenderness. Then you also check for the surface over the lump, whether it is smooth, regular, or whether it is having some nodule. You can check. Then edge of that site where the lump is there. So whether it is well defined or indirect edges are there, so you can palpate and mark your finding. Then consistency, whether that lumps is, whether it is stony, hard, when you are feeling, whether you feel that it is very hard, or it can be firm, that neither very hard or not very soft. That it can be rubbery, slippery, you can say that it is slippering under the skin, and it can be spongy or soft consistency. So what kind of feeling you are having, that you can assess through palpation and record your finding as per the checklist. Then cough impulse is another method in which you will ask the patient to cough and see if the lump increases in size. So when the patient is putting some pressure through coughing, so it will increase in size, or whether it is not increasing in size. So it is that you if it is increasing in size or not increasing in size, by that you can assess whether this lump is reducible or irreducible. So in case of hernia, the most specific signs for the diagnosis of hernia on clinical examination, you measure and you say whether by cuffing only it is protruding, and when the patient is in rest it is not visible. So it is reducible in size. You can reduce, patient is able to reduce, or it is reducible, and it can come down to normal size. But when your patient is putting pressure by cuffing, that time it is protruding, so it is irreducible. Size you can measure with the help of measuring tape. Thrill or pulsation, if it is there, that you can write yes or no. In case of, when you press on the lump, so pulsality, whether you check whether the lump is pulsatile, are you able to feel it or not. So it should be expansible pulsation or the transmitted pulsation. That means when you are pressing, whether it is pressed easily or whether it is expanding, or whether it is moving during pressing. Then compressibility, whether it disappear on pressure. You are putting pressure, and by putting pressure it is going off, or you are not able to feel it with the pressure, or reappear on releasing the emptying. When you are not pressing, that time it is releasing your pressure, but it is not visible at that time. So compressibility, whether it is compressible or not. Reducibility means reappear. That lump reappears only on application of another force, that is the cuffing. As I have informed you earlier, whether when patient is cuffing, then only it is visible, otherwise it is not visible. That means it is reducible. Then fluctuation, you check by, because you are doing the palpation here, so you check by 2 fingers moved apart when middle area pressed. You keep the lump between the 2 fingers and press whether it is fluctuating or not. Then percussion is another method in which you are putting your fingers, 3 fingers, index finger, middle finger, or the ring finger over the lump, and with the help of your other hand, using other hand, and with the middle finger you are pressing on the middle finger of the left hand, which you have put on the lump, and you heard the sound. So using middle finger of the right hand, you tap gently over the middle finger of the left hand and listen to the sound. When you listen to the sound, it can be dull sound or resonant. So dull sound indicate that because there is nothing, it is very solid lump is there. So you will have dull sound, means it is of solid nature. That lump is of solid nature. But if there is resonance, that indicates that presence of gas is there in that lump. Then you also do the examination, and this is with the help of movement, or you move. This is to check the plane of attachment, whether this lump is attached or it is displaced inside. So skin has to be checked to see the skin is fixed with the tissues lying beneath. You need to attempt to pick up a fold of the skin. You try to pick up the fold of that skin over the swelling and compare with the other side. And if you find that swelling, deeper structure, it is deeply situated, or whether all the muscles and the tendons are also involved. So deeper structure is the attempt to move the swelling in different planes relative to the surrounding tissue, and if the muscles and the tendons, then palpate the swelling, asking the patient to use the relevant muscles. So that way you can see whether the lump is attached with the skin or not. You can also listen over the lump by putting the stethoscope and listen for the bruit sound, or that is a fine gurgling sound can be heard, which indicate that the lump is having blood flow or in the blood vessel, so bruit sound will be heard. And over that lump side, if you throw light from a bulb, with the help of a torch you can take on the lump, and if it is illuminated, this indicates that there is presence of clear fluid in the lump. So these are the two other findings which can be assessed by the examination. So this was in general, we have discussed about the examination of the lump. And now we will come to particular organ or where these swellings are there. So if we see the swelling in the neck, suppose a patient has come to you with the swelling is visible in the neck, so again you will be doing the examination, and you know that thyroid gland is present or thyroid gland is situated in the neck region. So after taking the consent from the patient, and you are giving or exposing the neck region by bending head backward, otherwise you won't be able to see it clearly. So bending the neck backward and perform general examination, in which you first of all you can identify if there is any scar in the area. So maybe there is some previous surgery like thyroidectomy has been done or not, or you can observe for any obvious masses in the neck. So you can ask for in the history, you can take the history of any voice change, or there is any weakness or any hoarseness of voice, and if it is there, patient will say there is change in my voice, and since when it is there. So you can ask the duration and whether this change of voice is increased over a period of time or it is same. So because patient is coming to you today, but maybe he is having change in the voice since last maybe so many days, so you have to ask particularly related to the neck swelling. Then if a midline lump is present in the center of the neck, in the midline, if the lump is present, then you ask the patient to swallow some water, and you must have seen that a thyroid mass will rise as with the thyroglossal cyst. There can be thyroglossal cyst in the region, and if you ask the patient to protrude tongue, patient will protrude the tongue, and thyroglossal cyst will rise and the thyroid mass will not be there. So you have to assess for the different way, so that you can come to certain diagnosis. So you can also do the palpation over here. First, as we have talked in the general examination, we do inspection, palpation, percussion, and the various other methods. So here also you will apply these methods. So firstly, we have done the observation as well as we have ensured by asking some questions to the patient, and now we can do the palpation in the neck region for thyroid gland. So you can place 3 fingers of each hand along the midline of the neck below the chin. So locate the upper edge of the thyroid cartilage, as we usually say Adam's apple. So that has to be location has to be ensured, and move inferiorly with the 3 fingers. You come down until you reach the cricoid cartilage or the ring, and then first 2 rings of the trachea are located below the cricoid cartilage, and the thyroid isthmus overlies this area. So you can locate the thyroid and then palpate the thyroid isthmus using the pads of your fingers. Here it is very important to tell you same in the palpation method, when you are applying your fingers or using your fingers for the palpation, you will not palpate with the help of tip of the fingers. Whether it is the breast lump or the thyroid lump, you will not use tip of the fingers, because it can even be painful for the patient, as well as the sensory part. Sensory part is more in these pads of the finger rather than the tips of the finger. So this you have to remember while palpating. So this you do for palpate each lobe of the thyroid in turn by moving your fingers out from the middle area to the lateral side from the isthmus, and then ask the patient to swallow some water again while you feel for the symmetrical elevation of the thyroid, so which rises during the swallowing, as it rises during swallowing. So dear students, we will continue with the same topic after a short break. Thank you.